So the idea of, when I say narrative is how do you change, first of all, why do I think, or we should change the way we talk about it? And it's because I think what's happening is we're really good about talking amongst ourselves once we know what this disease is and what it is and how it affects us and everything else. But we don't quite understand how to appeal to a broader audience. I mean, so what are the things that we know about the disease that may catch somebody else's attention that's not diagnosed, that maybe has never heard of the word? Most of us didn't before we were diagnosed. So that's the idea with this assignment. What kinds of things are we not thinking about that you guys know, but maybe you're not realizing how important it might be to an outside audience? And in order for us to decide how we should talk about it, we need to understand what those descriptions are, what those images in your head are, the pictures that we paint, that maybe we have, but we don't know how to get out, how to communicate. And then what are the words? Because in today's world, we have maybe 15 seconds to get somebody's attention, if that. So, like I was saying yesterday, when I started in my career, it would take 5 times to get somebody's attention, or to actually understand. The person would recall seeing something that I was communicating. And now, I don't know. I mean, it's probably 20 times, if that more, because we have so much more noise going on. So it's really difficult to compete with your message. So words are critical, because in our world, in the communications world, we take all this information and try to distill it to one thought. Just do it, what Nike did. How great was that? All of a sudden, this brand goes from nothing to global leader of. So these brands, these words are really important. And I remember, because I have a good friend that worked for the agency. It was a Portland, Oregon agency called Wyden and Kennedy. And they had tested a bunch of campaigns with Just Do It. And the Just Do It campaign, the focus group didn't like it at all. It was just like, no, this sucks, And both the owner of the agency and Phil Knight, who was at that time the head of Nike running the thing, said, no, this is it. I don't care what the focus group says. We're going to run with that. So intuition is a big thing. But all of that work came from this kind of work that we're trying to do here for a disease like acromegaly. It's a systematic understanding of what's going on out there. And I look back, when we started 10 years ago with Pituitary World News, I think we've made some progress, but really, truly, we haven't made the progress that we need to make to get beyond our group. How do we get out to the other influencing groups? And we talked about who those are, nurses, doctors, primary care physicians, dentists, radiology, you name it, people, physical therapists, trainers, dentists, orthodontists. I mean, the list is endless. So anyway, and these are the things that we concentrate on. So let me, am I going backwards? Yes, sorry. So insights, that's what we look for. We look these things, and sometimes these things don't these programs are lots of work, a lot of fun sometimes, but sometimes it give us nothing. And sometimes we get these beautiful nuggets, gold nuggets of information where you go, look what this person is saying, or look how this person is telling the story. There's something here that maybe we should grab onto, and all of a sudden that word, that just do it, is, that's it. That explains it. We don't know what that is, and we may never come up to it, but I think doing the work makes a big difference. And because if you go through this trying to learn what's important and how we talk about it now and the types of things that make a difference, it's really important. If we're ever going to get to more people recognizing that there's a disease called acromegaly. There's other diseases in the pituitary gland that are very similar to acromegaly, and people go through the same thing. So if we know those mechanics and that narrative, I think it would be like a game changer. And these are the people, like I said yesterday, I went through this a little fast, but this is where the information has to come from. So these types of exercises we want to do with you, because we're patients, but also we want to hear from our healthcare professionals. How are they talking about it? And the same thing from our friends and family, from Kevin. How is he talking? It was very illuminating today how he explained his relationship and the things that he was going through to support Heather. I mean, those are the types of things that are very insightful as we think about the types of things that we want to communicate. The same thing with the public in general. You know, I want to know how people, or if you ask somebody that's never heard of it, well, have you heard of this disease? And what is it? Tell me what it is. And what do you think it is? No? Those sort of things are really important to understand. And then I think the government some government officials is important. If you were to ask anybody in the U.S. government or Canadian government, what do you think the percentage of people would be that say, I know what acromegaly is? 0, maybe. I don't know, maybe a few. Anyway, so having said that, just to kind of set it up, I know we could have a little time, so I don't want to spend a lot of time. And this is a project that if you have time and you find it fun, we're going to modify the questions a little bit, but go to the website and complete it. Go to this link. You'll be able to find it on Pituitary World News too. We'll put the link up. And if you can't find it, let me know, and I'll send you the link so you can complete it. And take some time to write. And write. This is a fun exercise. It's not think about. Try to step outside of yourself and write the story as let's say if you the obituary. Put yourself in a writer's at a newspaper or magazine's shoes and say, how would I write it if I were a journalist? And use your experience, but try to step away from you. I don't know if that makes any sense.
I'm going to walk around the microphone and I'm going to ask you, how do you bring up acromegaly when you're talking to somebody that doesn't know about acromegaly? And I'm going to start with my husband because I know he talks to his coworkers.
You're right. Not many people know about this disease. I remember when I first met Deanna, I can't remember if it was right away or... Anyway, she told me, I have acromegaly. And I went, And she says, well, Andre the Giant. And I went, oh my God, she's going to turn into Andre the Giant? And she says, no. He got it after puberty. I didn't know a thing.
Oh, Andrei Ruzanov was his name.
Yeah. I remember going to the first meeting with your endocrinologist, and I was in the room. And all this stuff is just like, whew. And then she asked, I want to meet somebody that has acromegaly. And no, we can't do that. Patient confidentiality can't be done. Well, I'm going to start a group. And that's the journey that I was on. And it's been a hell of a journey. I'm really proud of her. But getting the word out to people is hard. It's not something that people experience probably never in their lifetime. And it's like a kid coming out of school. I want to start working. I want $40 an hour. Ain't gonna happen. You have to start at the bottom. And it's getting in touch and getting experience and talking to people is the only way it's gonna happen. I used to use that analogy, Andre the Giant. I don't do that anymore.
Good.
I just tell them, well, she has this pituitary disease, and it extrudes growth hormone, makes her bones grow, and we go that route. And it's really, still, they don't really understand. It's really hard to explain what acromegaly is. I mean, it's easy. I got diabetes. Mm-hmm. Everybody knows what that is. But acromegaly, it's a hard one. It really is.
Yeah, I think that's really interesting what you're saying, because I think the rare part of the acromegaly, which is rare disease, is relevant if the person doesn't think it can happen to them. So I said, it's rare, it's never going to happen to me. Acromegaly is not that way. Acromegaly is a random disease. It's genetic. We don't know a lot about the genetics part of it, but it's random. So the idea that it could happen to anyone, it's an intriguing idea to me from a communication standpoint, because all of a sudden it's rare, but it's not that rare. And when you say to people, look, 1 out of 5, 1 out of 6, depending on what has a pituitary disease, some of them are, quote, clinically insignificant. They don't do anything. Maybe they do, maybe they don't. Maybe they just don't know where to look, right? Whether it's doing, and early on, it may be clinically insignificant, like what Dr. Prevatani was saying, well, there's no symptoms. But the thing is still there. And we don't know enough about the genetics of these things, of how they move and how they develop. I'm not a physician, but there are mutations and things that happen once the tumor is already there to get it to grow. And then it starts, depending on what hormone is affecting, it starts raising havoc on people. So when I think about communications, I think, okay, maybe the idea that it can happen to anyone, and like we've talked about here, enough is you don't want people to stigmatize it with Andre the Giant, because then all they look for is somebody that looks like Andre the Giant. If you don't, all of a sudden, it's not. Oh, look, it's he's far away. For me, when my doctor said acromegaly, I had no idea. I had heard of it. I would be honest, because there was some story on the Irish giants that I had learned. I go, oh, that's interesting. But when I got back home and went to Google and looked at it, and I saw Andre the Giant and the guy from 007, Jaws, and all the other, and I'm going, oh my God, you can have, I have this? It was the farthest thing from my, the understanding of I way out on somewhere else, that could never happen to me. It's too rare. I don't look like Andre the Giant, I didn't think. Anyway, so the idea that it could happen, it's like this is a sort of insight and nuggets that we look for. Should we talk about the fact that it can happen to anyone instead of saying what the disease actually is? And the minute you say to somebody, this is random and it happens in familial kind of, there's some strains that are more, genetically connected than others, but they really don't know. That's the bottom line. So anyway, that thought is one that we say, okay, maybe that's something that we should work on. Could we get through to more people? If I, instead of using a picture that obviously is acromegalic, I use a picture of somebody that looks totally normal, and I say, you could have this disease and you have no idea. You have it because it's early on. That imagery is really important. And when we talk about imagery and stigmas and words, that's what we talk about.
As we had discussed earlier, JD, I think it depends on who your target audience is.
Yes.
So I just looked up some stats, and I bet if I walked out of this room and asked people, the vast majority, 99.99%, would never have heard of acromegaly. If I walked out of the room and talked to the same people and said, have you ever heard of ALS?
It's a,
If I asked the same group of people if they had heard of ALS, I suspect that I would get more positive responses. Does anybody in the room have any idea of what the prevalence of ALS in Canada is right now?
no clue.
How many people have heard of it? Everybody. ALS, the numbers from the ALS Society are that there are roughly 4,000 people in Canada with ALS. It's a rare disease. It's only twice as many as the numbers reported for acromegaly. And yet people are aware of it, the general public.
Yeah.
So for me, if you're looking for the general public to have a deep understanding of acromegaly, you're not going to achieve your goal. If it's just an awareness that there is this disease and there's a constellation of symptoms, and you may look very normal, you're not going to look like Andre the Giant, but there are things that you could look for, like the enlarged fingers, the joint pain, all of the other treats that acromegaly gives in a constellation and in very varying amounts for the general public. For the medical community, to me, you would want to have your awareness be at a much deeper level. So because they should be advancing people, as Kevin had mentioned, in dealing through his journey, looking at all the medical practitioners that were involved in the diagnosis. And most of you that have it have gone through that same sort of scenario.
Yeah.
So how do you target your message for the segmentation of target audiences?
Yeah. Well, I think there's steps to this. Obviously, you have to know what your messages are and what your hot buttons are before you start thinking about how you're going to hit the different audiences. Otherwise, we're going backwards. But segmentation is critical, obviously, because each group is going to need tweaks on the. But I think if the overall idea, the narrative changes, then the key is what will make people pay attention. And I think the problem with Andre the Giant, that's it may be that Andre the Giant or something like that would be the solution, is that the Andre the Giant stigma, even though it explains the disease and lets you explain, oh, that's what Andre the Giant had, that's what I thought. It's stigmatized, it's not real. It's no, because it hasn't happened in 30 years. So that if people have been working on this, on acromegaly, for 30, I look at the PNA when they first started. We've been doing this for a long time. Shlomo Melmed, when he started, and he's the head of the Acromegaly World books. He's the guy that has written all the books, early books, and this is what these guys were talking about. Talking about acromegaly through the disease, the extreme disease doesn't work. People don't care. It's my yeah, because it's Andre the Giant. It's way out there.
I have the mic. Can you hear me? Yes. Oh, okay. Full disclosure, I'm Dominique. I'm with Ricordetti. I've been starting with this company 8 months ago, but really I'm starting to get familiar with acromegaly about 4 months ago. This is my first meeting. The first thing I want to say is, for me, coming in the room, I would be unable to say who has acromegaly and who doesn't. I'm a baby here, so I may be the audience. And I thought about the presentation you did yesterday where you were telling us to think about how to get the word out. And the first thing I want to say, and I've been in communication as well, in medical communication for over 25 years. I've been in breast cancer, helping to get the message about breast cancer. You all know about breast cancer, and honestly, cancer these days is a chronic disease as well. And so we can definitely look at those other disease, how they promote themselves. But I was thinking about, for me, what is acromegaly? And hearing in the last 24, 48 hours, one thing, like I had those catchphrases, something like, are your shoes shrinking? So it's not you the problem, it's your shoes. It's just catchphrase. Another one that I was thinking of is, what's your GH number? Like you have a nice t-shirt, and if you put on it, what's your GH number? People are gonna, what's GH, and you put the Acromegaly website under it, so people will have the curiosity to say, oh, because today everybody wants a label. And maybe I need to know what my GH number or IGF number, something where it entices people to go on the website. I think it's Andrew who said, my teeth felt funny. So do your teeth feel funny? Are your shoes shrinking? What's your GH number? So little catchphrases that are teasers. And honestly, with Andre the Giant, I don't know, like I barely know who that is.
Yeah.
I think,
it's like I think a catch-all word for extreme cases. We could
exactly,
be
which
Richard, whatever his name was, 007 Jaws, or whatever those pictures that you see.
Yeah, but you want to move away from that, right?
Exactly, in my opinion.
And be in the reality that people who experience, like another thing that I hear about all the pains that you have. And we just had the Olympics. And I don't know if you know, but those athletes are constantly in pain. Let's it's a reality. And it's not because their GH numbers are elevated, but you guys, there could be some relation between, are your joints, are you in pain? Are you an Olympic athlete? And again, I have the website. So these are things that you can bring out that is from your everyday life and that are teasers and that entice people to say, hey, I want to go check it out,
Yeah. The interesting thought, it's a thought, because what you're saying is really interesting. The growth hormone, for example, has this broader appeal than, let's say, IGF-1. Because growth hormone hits a whole bunch of other audiences, like sports related. So I know that when we've written about abuses of growth hormone that could lead to acromegaly, that gets a lot of attention. Because there's a lot of people that are athletes or wannabe athletes or people that are going, oh, look, if I take some growth hormone. Well, all of a sudden now you have an audience that does not have acromegaly, that it's interested in learning about growth hormone. So using growth hormone as a vehicle to get into acromegaly is something we've tested, and I can tell you that if I write something that says acromegaly something or other, gets hits from all of us. If I write something that says growth hormone, then it gets hits from I don't know whom, but it's a lot more than the acromegaly community. So I'm deducing from that there are people that don't have acromegaly that are reading about, all of a sudden, maybe for the first time, see the word acromegaly.
Well, on Facebook, there's going to be always this guy who's supposed to be 80, and he looks like 60.
Yeah, and then he has a heart attack.
And he said, because I take injection of growth hormone.
Yeah.
So, an athlete who will take growth hormone to be more performant, well, it gets them in trouble. So there's this whole thing around growth hormone. In one sense, people could think, wow, you're so lucky you have excess growth hormone.
Yeah.
So that means that you'll live until 90 and look great? Well, maybe not. And that's where you can, again, say, well, too much of a good thing is not always a great thing.
Exactly.
So these are very basic things, but it's, and today with, it used to be Twitter, now it's X, where you have 140, is it 140 characters that you can put in there?
Well, yeah, we were talking about that. You have 15 seconds to get somebody's attention, if that.
Yeah, so you need to have something very short, but that has impact. So anyway, that was my brainstorming.
No, that's a good point, because it's kind of like this trying to find those nuggets and those things that may create a little more attention. So we learn how to broaden the audience. Thank you. No, good points. Those are great points.
Those are excellent points. Okay, Jeff?
Um, it's on?
Yeah.
Okay. I'm going to get back first to how you talk about acromegaly, and then I'm going to segue into something else. So I predominantly work in a male-dominated environment, and a lot of the people are not necessarily highly educated, although we have exceptions, of course. But what I explain to people, I say, have you heard about acromegaly? And they say, no. And I say, well, I said, your pituitary gland is basically the central processing unit for your body. It controls a number of different functions. Yeah, well, it's a tumor on your pituitary gland. And they go, oh. And I said, it can have all these different repercussions in that. So it dumbs it down, it puts it across in a way. And then I also will go back and I will mention Andre the Giant and Jaws and these other people as well. But and this brings me to my second point is you mentioned about ALS. Well, ALS, what's another name for it?
Lou Gehrig's disease.
And right. And
Very
so
famous.
his name was attached to
Yeah.
it, and he brought it recognition. If I mention the word Parkinson's, which name comes up? Michael J. Fox. You need somebody who is a celebrity that you can attach the name acromegaly to. You get that, you get your exposure.
Yeah, but I think the trick is, yeah, of course. I mean, that's the trick is once you get that celebrity, how you're going to talk about it, and two, you hope that the celebrity is a right celebrity and doesn't go south on you. I'll give you an example of several brands that use Mike Tyson, and then they couldn't run faster than to try to get away from the guy after he did all the stuff that he did. So celebrities have this double-edged sword, and I agree with you. If you find somebody like Lou Gehrig, who is a hero, Michael J. Fox, who's loved worldwide, that's great. But then you still have to figure out how you're going to talk about that once you have that celebrity to. So my sense is that if we figured out the narrative and the brand, let's say for acromegaly, then you may have celebrities that don't want to participate to start jumping in because the stigma isn't out there. And people like, I don't know, I mean, Tony Robbins has been talked about having acromegaly. Somebody that does that has that name, may be able to help a lot. And there's many other people probably with acromegaly that are famous that may come forward if we figured out how to make it more appealing. I hate to use that word, but that's the thing.
There's lots of famous people with acromegaly.
I'm gonna guess, yeah.
You can look them up on the website.
Yeah.
There's lots of famous people with acromegaly, and you're right, it's stigma. They don't want to get out there and promote it to bring awareness for people to get diagnosed earlier because they don't want it to affect their careers.
Yeah,
But that's what we need. We truly need somebody that really wants to help make a difference, not just in Canada, but worldwide, to help us understand this disease so they can get diagnosed earlier, because it's a better quality of life if you get diagnosed earlier, right?
So if we have a minute, we got through. We can after you guys have a comment. I don't know if we have a minute, but it'd be fun to if everybody could just say the three words. We talk about listing the three words that come to mind when you think about acromegaly, what they are. And in the exercise, if you want to go through it, just write 10, then come back to 3, and then 1. And I can modify that to make it a little easier to get to the 3 and 1. So, sorry.
So I just wanted to add on what was coming up. I think Bruce hit the nail on the head when he asked who's the audience? Because in listening to the room, there's two potential audiences. There's one where we want to reach people that might have acromegaly, or so that they're aware of how to get an early diagnosis and catch it earlier. And that's where you would want someone that isn't the Andre the Giant example. They're John Cena or The Rock or someone else where people are looking at it and go, wow, that person's successful and they're living a fine life with none of these major complications that we associate with Andre the Giant. And so you want to demystify it in a way where people are not afraid to seek help and to get a diagnosis. But then there's the other piece around raising general awareness that got raised around ALS, where you want people to be aware of what the disease is. And with the general public, they don't care. They want to know how to react when someone tells them they have acromegaly. So when someone tells you, like if I told you I've just been diagnosed with ALS, you would all feel bad for me because you know I have a death sentence and you know I'm headed to hospice care. If someone tells you they have cancer, you know that they have chemo and they're going to die, or they're going to have chemo and they're going to get better. And so you know how to react. If someone tells you they have diabetes, it's essentially the same as them telling you that they've got celiac or they're a vegan. You know how to interact with them, and you don't treat them any differently. But with acromegaly, the gamut that you run through is so much more difficult to understand, because even just going around the room when people are saying how they got diagnosed or what their symptoms were, or even if we did like the example of what was your IGF-1 level at diagnosis or something on a shirt, and we all wore it around, like all the people with acro wore it around, people would go, I didn't realize you were 1,300. I didn't realize you were 1,800. I was only 600. And you get, even to try to understand, like if someone was 600 and Mark was 1,800, that's triple the amount. And to try to understand what Mark went through is really difficult. And so it's that challenge. So who are we trying to reach, and what's the level of awareness we want to attain? Because that affects the messaging that we're going to go out with. Because if you're trying to let people know that it's a difficult disease to live with and it's going to affect you for the rest of the life, then you don't have like Rock or John Cena as a good example, because people don't look at them and see any visible impact on their day-to-day life. But if you're trying to demystify it, to get more people to go get their blood tested or to go talk to an endocrinologist, you want to have that more gentle introduction. So I think it's a really framing who are you trying to reach and what channels, because you could do both at the same time through different media. So that's my thoughts.
Yeah, and that that becomes a sort of the strategy of how do you get to the audiences, and so yeah.
Mark said he had his hand. Tracy next? I just wanted to say that the problem I see with the Andre the Giant as our like poster person is, I cannot tell you how many times I've heard from medical professionals, you don't look like you have acro and I would have never checked you for it. So having that as the image, especially in the medical community, is damaging because it gives a perception of what you need to look like before you could have acro.
I agree.
I agree as well. What I would say, though, is just going back to my dad's point about ALS, there's a shock value there. And to Kevin's point, that is a death sentence. We know that these people are terminal. And so that's a different sort of messaging and awareness campaign as opposed to acromegaly. And so I don't want to say there's a value in the Andre the Giant, but there's a shock value in like getting people's attention and then saying, don't want to look like this? Okay, good. Now let's talk. But to your point, from a medical profession, we don't want that being the face of it. So it's a really nuanced challenge that we have, I think. And yes,
yeah,
I'm
well,
really enjoying
if
this
it'd be
discussion.
easy, we wouldn't be sitting here.
But you got to understand, people that don't get diagnosed do die.
Yes, no.
I should have died that night I had my heart attack. But the cardiologist, the specialist, had heard about acromegaly for 10 minutes while he was learning how to be a doctor. And he reached out to find out how to test it. If he would have just treated me and said, okay, you need to go home and take this medication, my endocrinologist straight out told me I would have been dead in a year. So it can be life-threatening.
Can I have a turn now?
Yeah.
Okay, so you talk about going outside of this room and asking people if they know what ALS is. Everybody's going to put their hand up. But you ask about acromegaly, and you're not going to get the hands up. Now, I don't know if we sometimes forget, but gigantism and acromegaly are separated simply by puberty. Now, I have both. My tumor started while I was still in puberty. So, do I have gigantism? Do I have acromegaly? It doesn't matter. No. It's the same thing. It's a tumor on pituitary gland separated simply by your age. So, if you go outside of this room and ask people if they know what gigantism is, they're going to say, yeah, I've heard of that. I know what that is. So why do we have to? I mean, acromegaly. We know that's what our disease is called. It's not a sexy name.
No.
It'd be cool if we could change the name to something that's a little more catchy, like, yeah, a bet. Like if we call it gigantism,
Can
which
you
really
hit the
it is.
website? Yeah.
It really is gigantism, right? So why can't we use that word? You know, really? Because and there's a lot of examples. I mean, we've got Robert Wadlow and Richard Keel and all these really famous people that had gigantism.
The website.
So why can't we latch onto that? Yeah. Or mid. So
Yeah, that one. Yeah, there you go.
anyway, that's what I have to say. So I mean, there's some people that are giants, and there's some people that are giants on the inside.
There's that
Right.
right there.
Oh, just the word. Oh. Oh. Well, there's also women in history that have gone through the same thing too. You know.
I think the Andrew Giant example is one of those.
It's very different.
examples.
This disease is very different for women than it is for men. Because for men it accentuates the masculine features, and for women it gives them more masculine features. So it's psychologically and physically, it's a completely different disease that I have than you have, even though we have the same disease. Psychologically. So to make a quick point, I wanted to show you, because I read the article with Heather's beautiful face there and photograph. I think renaming acromegaly is a good idea. And we wrote this article. I wrote it just to see if I could get a rise out of people. And oh my God, it just started coming in with everybody's. One that loved it. One of the comments I loved, it says, "Don't you have other things to do?" Which I thought was perfect. But anyway, read it, because I think there's some interesting stuff, and then send me some comments. But I think the idea of renaming, it's a good idea, because I think the name sucks. I didn't know that was already a topic of conversation.
I was just gonna.
Yeah, no, but I think it's a really good thought, Mark.
Wow, supermodel Heather.
Fantastic. Yeah, that's a great shot.
I was just gonna say on one of the examples when we're talking that Heather raised was just in the stage of diagnosis, and there's all the examples from like 100 years ago of whatever, all the pictures of people that had never been treated or that got treatment way after, and I think some of it to link to what Melissa's study is with Dr. Cusimano about how early diagnosis can have an effect, and that the average diagnosis length takes over a decade, that there's space there to do some of the idea around, I remember it from lung cancer with smoking, where they said, like, here's different stages. And they said, like, go get checked or stop smoking today because every other day you wait causes more damage to your lungs or something. And try to, you don't want to use that shock value of saying, like, here's this French wrestler from 1924, like Maurice, whatever, that Shrek is based off. And as an example for people, because it's really rare that it would go that far without any sort of diagnosis now. But you don't want people to even start on this journey, so that you have the room full of people where somebody that gets told about what the disease is in the hallway says, all right, there's 12 people in the room with it, come pick them out. You don't want them to be able to identify it. So how do you get people to be aware of it and get that early diagnosis? Like, try to find a way to speed it up for the medical community, so that what happened to Tracy doesn't happen to anyone else. And Andrew mentioned it as well, where he was having trouble getting someone to take him seriously with this. So you want to, like, I guess the third audience is the medical community. How are you explaining it to them? And maybe that's the one where you say, like, this is what acromegaly looks like. It doesn't just look like this end point of some horribly untreated person. Because for every other disease that doctors are seeing, they're not only seeing people that have never been treated to that point.
Anybody else?
If you were to change the name of acromegaly, you would need to leave it hyphenated with the new name that you wanted to transition to, because then that awareness with all the doctors around the world and or other media that you've reached out to and patients that you've reached out to, public that you've reached out, is lost. So you'd have to go, whatever it was going to be, acromegaly, super person syndrome, and then eventually you could go super person syndrome 20 years later.
No, not an easy task, and it requires even more work in terms of understanding what the insight is than changing a narrative. But having said that, people rebrand all the time, so it's something to think about. And the work of doing renaming creates a whole bunch of information too that you may be able to use. Yeah.
But when Nissan decided, the original automotive manufacturer of the Datsun, decided, we're going to go to Nissan instead of Datsun. Boy, it took them about 20 years to recover from
Oh,
that.
yeah, sure. Lots of mistakes. That's been the
Hi, everyone. I think as just somebody who's like on Instagram and TikTok and all those things, and we brought up ALS, and I think people know about it because of the challenge, right? That whole ice bucket challenge, that was really popular, pouring ice water on your head. But I think if you went outside here and asked people what ALS stands for, I don't think many people would be able to tell you what it stands for. I think people know what the challenge is, and I think you have to be careful, because what happens is people know it for a challenge and not for what it is. And the question becomes, do you want people to have knowledge or awareness? Because awareness without knowledge doesn't really mean anything to anybody, right?
It has to lead to something else.
Yeah, so as somebody, this is my first experience at the conference and meeting everybody, but all of you that have it are the best people to bring awareness to it. I've learned so much over the last couple days because I got to speak to everybody and I got to hear about firsthand experiences, and that's where I got knowledge from. And I said this, I was saying this to Kevin and Jeff. It's great to hear doctors speak about it that may be endocrinologists or neurosurgeons. It's awesome. Mm-hmm. It's great to hear about the research papers, but to hear about the experiences of day-to-day life and what you guys go through and how life is and what it is where I learned the most. And I think in that is where you'll find the awareness will be most effective and most impactful. Because it's not enough to just do the ALS thing and because people don't know what it is. People don't even, Lou Gehrig's disease, great. What is it? And it doesn't really have an impact unless there's a knowledge. Thank you.
I think the brand, it's going to give you the relevance and want the people to want to learn more. The problem is that if the brand isn't right, then the messaging that you're talking about goes in one and out the other. And that's what happens. You have a lot of great stories that are not being heard or not being understood or processed because the brand isn't right. So this is almost like out there in the clouds that we're working on. What's this big idea that is going to get people to pay attention? And that's why this exercise is so important, because the message, the knowledge, and the understanding comes from you guys, from us, that understand the disease. And I will tell you that for me, I think there's this kind of tunnel vision that I have. I've been thinking about it for 14 years because that's when I was diagnosed. So I don't have a fresh idea in all this. I have all this bias stuff that I've been dealing with. So hearing from you is critical, and hearing from all these other audiences that how do they talk about it? What kind of information can they give us? Anyway, but so please look at this. Complete it if you can. It's going to be fun to do, I promise. Share it. Get it out there. We'll write an article. I'll send it to Deanna, and there'll be a link in there. So if you can post it and get it into your groups and send it out. as many people as you can, and let's see what we get. And hopefully we can sit here next year and say, here, this is what we learned, which would be great. So thank you. And thanks,
Awesome.
Heather, for letting me use that picture.
Thank you, everybody.
Thank you. Thank you all.